Hi, I'm Lisa Ferentz. And when I work with self destructive behavior in my clients, one of the things that I think is so important to keep in mind in terms of treatment is making sure that you are incorporating right brain based expressive modalities into the work. This is my way of saying to you that simply doing talk therapy alone is no longer enough. And frankly, part of how I define what it means to be a trauma informed therapist is knowing and understanding that you have to bring in expressive modalities. Now, part of why this is so important is because we understand now that trauma is not stored in the languaging part of the brain. Because it's stored visually and viscerally, we need to be able to bring strategies into the room that enable our clients to use things like art, collaging, sand tray, movement, somatic resourcing. When we can bring those modalities into the room, we are helping our clients to be able to access where their traumatic experiences have actually been stored. So again, I think it's so important in this day and age that you are getting additional training in paradigms and modalities that allow for creative expressive expression, and that it's not just about talking about the way in which they hurt themselves or talking about the wounds that they've made. It's about giving them permission to draw the wound. It's about using a sand tray so that they can create a sand scene of what they were emotionally feeling either before or after they got the impulse to hurt themselves. It's about going to sensation on the body and recognizing that that's where memory is stored, something that Bessel van der Kolk has done a lot of research about in his work. And we need to feel comfortable as clinicians who are working with folks who do destructive behavior, because there often is an underpinning of trauma associated with that. We need to feel comfortable bringing in those kinds of modalities actually into the therapy room itself. In addition to that, we want to encourage clients, kind of as a bridge between sessions and to give them a sense of continuity and continued healing. We want to invite them to do homework assignments that include these creative modalities. So whether we are inviting clients to continue to journal, not just journaling, but sometimes journaling with their non-dominant hand, so that again, they're accessing a different part of the brain, inviting them to do collages at home or do drawing at home, teaching them how to work with physical sensation through something like focusing, doing somatic resourcing through breath work. These are things that are easy for clients to take with them and to do outside of session. And when we do that, we're actually strengthening their affect regulation toolkit. And when we can give clients other ways to self-soothe, to comfort themselves, to communicate what they're experiencing, they don't have to immediately turn to self-destructive behaviors, to dissociate, to be numb, to communicate in a less healthy kind of way. The other thing I want you to keep in mind is that clients who do self-destructive behavior are in actuality very creative people. I think they often get a very bad rap in the mental health field because they often get misdiagnosed and they get pathologized. But when somebody is attempting to express their pain through cutting, through burning, through an eating disorder behavior, through an addictive behavior, not that I'm in any way condoning it, because obviously the goal in therapy is to help them move away from those behaviors. But I do think it's important that as therapists, we look at these folks through that lens and recognize these are creative people, and they are desperately turning to what in their mind are the only ways that they can communicate, self-soothe, and comfort themselves. So when I offer my clients an art project, for example, or a writing prompt, or show them how to begin to work with sensation on the body, they're actually very willing to go there, because by definition, they've already been using creative stuff in their lives. The very fact that they have survived and coped with what for many of them have been a childhood of a severe abuse, neglect, rejection, abandonment. These are creative, resilient folks. And so when you bring creativity into the room, it actually resonates for them. And they're able to fairly quickly use those strategies. The only kind of caveat that I want to suggest is that you let the client know that there's, quote, no wrong way to do it, because you want to try to decrease any sense of performance anxiety that they might have, especially if they've never drawn, in with you before, or they haven't picked up a crayon in 25 years. You want to let them know that whatever happens, you'll be able to creatively process and use and work with, and that there is no wrong way to do it. And that can go a long way towards alleviating their anxiety about doing something kind of out of the box, doing something that's different. But I urge you to bring it into the room because you will go a lot deeper with the work when you're able to bring those strategies in.